So what are advanced chronic wounds and how do we stage them? Meaning, how do we give them a grade from 1 to 10? Advanced chronic wounds are wounds that fail to proceed through the normal stages of healing in an orderly and timely manner. They often remain in the inflammatory phase for an extended period of time, failing to heal within the expected time frame. Typically, wounds that do not heal within 3 months are considered chronic. Factors contributing to a wound becoming chronic include infection, poor circulation, compromised nutritional status, underlying health conditions such as diabetes or vascular disease, and repeated trauma to the wound area. Chronic wounds can significantly impact the quality of life and may lead to severe complications if not adequately managed. They require specialized care and often necessitate a multidisciplinary approach for effective treatment. The staging of chronic wounds is crucial for assessing their severity, guiding treatment strategies, and evaluating healing progress. While there are different staging systems depending on the type of wound, the following outlines a general approach to staging pressure ulcers in general. One common category of chronic wounds as an example. Stage 1. The earliest stage of a pressure ulcer is categorized by non-blanchable erythema, meaning the skin remains red when pressure is applied and then removed. The skin is intact, but it may be warmer or cooler than the surrounding area and may feel either firmer or softer. Stage 2. At this stage, the skin breaks open, wears away, or forms an ulcer, which is typically shallow and can look like a blister or a small crater. The wound is now open and involves damage to the epidermis and possibly the dermis. Stage 3. The ulcer deepens, extending into the subcutaneous tissue beneath the skin, potentially exposing fat. The depth and characteristics of the wound can vary significantly, and there may be tunneling or undermining, which are channels that extend from the primary wound below the skin surface. Stage 4. This stage involves full thickness tissue loss with extensive damage or necrosis of muscle, bone, or supporting structures like tendons or joint capsules. Stage 4 wounds are severe and present a significant risk of infection and other complications. Finally, we have unstageable or unclassified wounds. When the bottom of the wound cannot be seen because it is covered by dead tissue, slough, or a scar, it is considered unstageable. Determining the true depth and therefore the stage of the wound requires debridement, which is removal of dead tissue. Deep tissue pressure injury, or DTPI, is a type of injury that presents as intact or non-intact skin with localized area of persistent, non-blanchable, deep red, maroon, or purple discoloration or epidermal separation revealing a dark wound bed or blood-filled blister. Management and treatment strategies for chronic wounds are determined based on their stage, underlying causes, and patient-specific factors. It is vital for healthcare providers to assess and document the stage of chronic wounds accurately to tailor the care plan appropriately and monitor the wound's response to treatment over time. This is essential to promote the healing process in a timely fashion to avoid the multiple and possibly even fatal complications associated with advanced chronic wounds. That's about all you need to know about staging of chronic wounds. If you'd like to know more, give us a call. See you soon.